Hypertension Awareness Series, Episode 10. Good morning and welcome. Today, we talk about hypertension in Africa and Kenya, a growing threat close home. Hypertension is rising faster in Africa than in almost any other region of the world. What was once thought to be a disease of wealthy countries is now a major driver of illness and death across African communities, Kenya included. Africa's hypertension burden is rapidly increasing, and current data shows that 30 to 40% of adults in many African countries now have hypertension. Urban areas are more affected, but rural rates are also catching up fast. People develop hypertension in Africa at younger ages compared to hypertension in high-income countries. This means that Africans are living longer with uncontrolled blood pressure, increasing the lifetime risk of stroke, heart failure, and kidney disease. So why is hypertension rising very fast in Africa? Several factors are driving this epidemic. Rapid urbanization, processed and salty foods that are replacing the traditional diets, reduced physical activity and more sitting, rising obesity and diabetes. There is also high psychosocial stress and economic pressures. There is limited routine health screening. Our environment has changed faster than our health systems are doing. The situation in Kenya is also concerning. There is underdiagnosing and underrecognition of hypertension. In Kenya, 1 in 4 adults have hypertension. More than half do not know they have it. And among those who are diagnosed, most are not on treatment. Among those who are on treatment, only a small percentage are well controlled. So the biggest problem is not just the disease, it is the long-term the late diagnosis and also the inadequate control. Men and women also face different barriers. Men are less likely to attend routine checkups. They often present for care only after complications, and there are higher rates of undiagnosed hypertension in men. Among women, frequently there is delay due to caregiving roles. Pregnancy-related hypertension also increases the lifetime risk, and economic dependence may limit access to treatment. Both groups are at risk, but in different ways that require targeted solutions. Many people in our setup first present with complications, and sadly, in most of our hospitals, hypertension is diagnosed when patients come with stroke, heart failure, kidney failure needing dialysis, vision loss. By this stage, damage has already occurred, and there was a missed chance of prevention much earlier on. Hence, the importance of community screening. There are other gaps to long-term care and follow-up in our setup. Even after diagnosis, many challenges remain in Kenya and in Africa. The cost of medication is unaffordable. Medication stockouts. There is also poor understanding that treatment is lifelong. There is fear of dependence on drugs, use of unproven alternatives like herbal remedies, lack of regular follow-up and BP monitoring. There is inaccessibility to care and also affordable treatment. The important thing is that we need to look for long-term care models. Clinic-based care cannot fight this disease. Effective control requires community, faith-based, and workplace screening programs and education, affordable medications at primary level, family involvement in lifestyle changes, national policies on salt reduction and food labeling. Hypertension prevention must move beyond hospitals into the homes and into the community. So what can you do today? Check your blood pressure even if you feel well. Encourage a family member, a friend, a colleague, a workmate to get screened. Reduce salt and processed foods at home. Stay active most of the days of the week. If you have hypertension, take medication as prescribed and consistent and regular follow-up. Share this message to make someone aware about the importance of hypertension. Stay tuned for our next important episode where we learn about hypertension in the young, why hypertension is no longer a disease of only the elderly population, especially in our setup. We are seeing increasing number of young people with hypertension. As always, Dr. Muthui-Mutua, saving lives one heart at a time.